Dr. Joseph Kanu understands that one way we can honor God is by being as healthy as possible. Dr. Joe believes modern science proves the healing abilities of remedies found in Scripture, and as a practicing chiropractor, blends those biblical truths with cutting-edge technology to enrich his patients' lives physically, emotionally, and spiritually. Welcome to Simple Truths for Healthy Living with Dr. Joseph Kanu. Listen for the next 30 minutes as Dr. Joe shares tips to help you live the healthy life God intends for you. To be a part of the show, call 313-838-1035. That's 313-838-1035. And now your host, Dr. Joe.
Well, good evening, everyone. This is Dr. Joseph Kanu, and we have Dr. Jeff Haddad with us tonight.
Dr. Joe, back again.
Back again, Jeff.
Wednesdays with you. I always look forward to them.
Boy, usually I'm here and just lonely staring at the four walls, and now I have your...
You know, I'm listening to you on other nights, and you sound lonely.
Yeah.
You know, I feel like you need me here. No.
Yes.
I'll tell you, actually, I give you a lot of credit because, I mean, sometimes when you're holding that whole half hour, it's impressive.
Yeah.
It really is. So hopefully I can chime in enough just to give you a little break on Wednesday. That's kind of your midway week.
That's right.
Break.
Midway through, I'm counting on you. So, hey, Jeff, let's start with a prayer.
Okay.
From we're going to do a reading from Mark chapter 13, the greatest commandment. One of the scribes, when he came forward and heard them disputing and saw how well he had answered them, asked him, which is the first of all commandments? And Jesus replies, first is this, hear, O Israel, the Lord your God is Lord alone. You shall love the Lord with all your heart, with all your soul, and with all your mind, and with all your strength. The second is this, love your neighbor as yourself, and there is no other commandment greater than these. Isn't that simple? Jesus really simplified it, didn't he?
It's
love
a
God,
message.
love your neighbor, baby.
Yep.
That's it. So, Lord, we ask that you give us utterance and guide our words and our tongues and open the hearts and minds of the listeners that we gain better knowledge and wisdom so we have better strength and ability to serve you and your children to a greater capacity. In Jesus' name, amen. So, Jeff, with that, what are we going to talk about tonight? Huh?
Well, I say we've talked about so many different topics over the past however many. We're going on our year.
We're coming up on
our
year
anniversary.
Yes.
I think. But we are. It was interesting. I came across, as you know, I like to do my research.
Yeah.
Came across a really cool article that was titled 19 Habits That Wreck Your Teeth.
Oh.
Okay. And
now I've heard of 7 habits of highly successful people. Leave it to Jeff. How to train wreck your teeth in 19 simple lessons.
So 19 very simple, just like Jesus, very simple habits that wreck your teeth. And so the interesting thing is that we have covered a lot of these.
Wow.
The other interesting thing is that I think I do 15 of these 19. Okay? And thank God I'm a dentist because I'm going to tell you.
You hypocrite.
That's the good news about what I do. I am never a hypocrite. I educate, but I do not judge because I do a lot of these things. And the moral of the story today for our listeners is there's a lot of these habits, honestly, it's a choice. You can quit. You can stop. Other things, if you don't want to, I've got some tricks to kind of absolve you of those bad habits, or at least hinder the repercussions.
Okay.
So that's what tonight's about, and we're gonna see what happens. We're gonna see. I'm wondering.
Jeff, tell me, if I do one of these, can I go to confession to you and have absolution or something?
I hear, and I don't judge, and I fix, and we try to learn from our mistakes.
Okay.
That's what we do in my office.
I love that.
No, I'll tell you, and some of these are going to be very, I think, common sense, to be honest. The first one, I think everybody's heard of this, chewing on ice. Chewing on ice is just a classic, and honestly, do I do it? Yes, I do. Do I do it To the extent that other people do, no. But if I'm sitting there drinking my water and I've got a little stress thing happening, and I'm just kind of crunching on things, it's fine. But I'll tell you, it's really a habit that for some people can be catastrophic for teeth. I mean, you think about some of our patients we've talked about in the past that have the large amalgam fillings,
right,
that have the big silver strip right in between the tooth. Well, what does ice do? Well, first of all, it makes metals expand because of how cold it is, right? Then you're biting into something that is arguably extremely hard. Correct?
Correct.
And now you got a wedge technique.
So not only is it hard, but you're saying the temperature factor.
Absolutely. And so what is your analogy when it comes to
like
these
splitting wood?
Like splitting wood.
And putting a wedge in there. And
you got it. You got it. So there you go.
That's what the amalgam filling is like the wedge you're saying.
Right.
And then you're coming down on this wedge and it will crack the tooth.
Right. And, I'll go one step further. And this is actually a really sad thing, but it happens. On a lot of patients, especially grinders and clenchers who have a little bit more, weakened teeth, I've seen virgin teeth, no filling, no wear, nothing. And you come down on it the right way with anything, whether it be ice, whether it be an almond, a popcorn kernel. You get a fracture on that, and patient calls, my tooth hurts when I chew on it, and we look, and you don't see a fracture. But there's a hairline crack right in between the entire tooth, and actually necessitates having the tooth taken out. And it is and it's so it's such an emotional thing for a person, especially for somebody who takes care of their teeth, to come down on something like that. So, moral of that story is let's avoid things that can cause those catastrophic results. Ice being one of them. I mean, it's one of those things. This is not a hard habit to quit, okay? Yeah. I mean, but it is a habit for a lot of people. People like to do this. Oral fixations, they need something to happen. And a lot of these habits we're going to talk about today, oral fixations, okay? So, next on the list, and we've talked about these, playing sports with no mouth guard.
Right.
You want to wreck your teeth? You want to wreck, lots of things besides your teeth. Your temporomandibular joints, your jaw, all kinds of issues. And please don't think that this is just a hockey thing, okay, or a football thing. How many NBA players are you seeing right now?
That's what I think. Hockey, football, or boxing, you need a mouth guard.
Right. I mean, normal things. But you think about, soccer. I think I've spoken about a patient of mine, beautiful girl. She was a goalie for soccer team. I had to do 4 root canals on her because she took a ball right to the bottom of her chin, up lower teeth hit the upper teeth, cracked them. Each one of them needed root canals. And so there's a lot of sports out there. I mean, it doesn't have to be a contact sport to be a contact sport. Okay, I mean that's really what I want people to remember. And wearing a mouth guard. Now, obviously, we've talked about in the past. You can get them at the store. Okay, are they as good as the custom mouth guards that a dentist can make? No, they're not. They're not even in the same league. Are they better than nothing? Yes, they are. But the way I look at it, if you're looking at buying one and you compare a $5 to $10 one to maybe a say $40 to $75 one, that custom fit, it's worth the money, in my opinion. And again, that's not coming from the dentist. I think you and I have both thoughts.
I would agree. If you're going to get one that's custom fit, because if you take a hit, that's going to affect your jaw then, right? If the teeth aren't occluding properly. So how much are yours for a kid? I'm putting you on the spot here.
We charge about $75 for a whether it be child or adult. I mean, we make them custom.
And it's a custom made.
It's a custom fit. And again, you actually hit the nail right on the head with the fact that it's that fit. I mean, if there's any play there, I mean, if you're wearing a over-the-counter mouth guard and it's just not in the right position, when that impact happens, it might as well not even be there. So to have it custom fit where it's not going anywhere and always be in the proper position.
Are yours thinner too? I mean, the custom ones.
They're I wouldn't say they're thinner. They're more molded and comfortable to the mouth. Exactly.
So you're more apt to want to wear it too. I would think.
Agreed. I mean, one size fits all. How often does that work in the world, really?
Right.
I mean, are one size fits all shoes? No.
Yeah.
I mean, there's a lot of things that one size fits all, maybe a parka, a rain
Right.
parka, right? A poncho. But no, I mean, no. And then,
Yeah.
so yes, they're more comfortable because, they're built for you
So
specifically.
really should be the price of doing business. You pay the price to play.
I think
If you're
so.
going to play,
Make it part of your equipment.
because this can cause not only jaw concussions, I mean, serious injuries can be avoided.
No question about it.
Having a proper mouth, but if you're going to have a mouth guard, have one that's custom fit by an expert for sure.
I agree. I completely agree.
Yeah.
And so, no.
You really sold me on the show we did, and there's a whole show you can listen to, Dr. Jeff. SimpleTruthsForHealthyLiving.com, and all of our shows are on Simple Truths for Healthy Living. Yeah. We've got a search engine. You can just type in mouth guards.
Exactly.
Right, and that website will also take you to Jeff's website.
Correct.
It's LinkedIn. You can see all your info.
Yep, RochesterAdvancedDentistry.com. We even have our shows, our radio shows listed on our website too, and it's nice because, I'm hoping that we have avid listeners, and I know that we do. But if you missed a show, or if you're just catching us for the first time, there's a wealth of information there. I mean, really, I'm so proud of the content that we've put out there because it's very informative for patients. I've had patients find you specifically because they heard us and we talked about a problem that they had or a symptom that they were feeling, but they didn't know what was causing it. So no, couldn't say enough about the websites for educational purposes and really find the answers you're looking for. This next one doesn't pertain to either. This is one of the few habits that does not pertain to me, and that's bedtime bottles. I am past that stage in life.
Bedtime bottles?
Yes. But you have heard of bottle decay. I'm not sure if you have or not. This was a very big common thing, really, in the past. I mean, people are a lot more educated these days. However, some moms, to make sure, when they have that desperation that their child will not sleep, they let them go to sleep with that bottle. And it's about the worst thing that can happen. I mean, having milk or formula or juice just literally sitting on the teeth essentially dissolves the baby's teeth. And, I'll go one step further of people thinking right now, well, yeah, but there's baby teeth. We'll get new ones. Well, yes, we do. However, if that decay is in the mouth, that disease is in the mouth, adult teeth coming into it, they will catch that disease. Okay?
Wow, great point.
The cavity bacteria.
So it's not a matter of it's their baby teeth, so what?
Nope, it's the oral environment that is not going to be healthy for your adult teeth, and it will be a downward spiral for them in the future. In addition to the fact that children, there's a big self-conscious, overall self-image thing there too. I mean, you do not want your child having no teeth.
Right.
Believe me, we don't need teeth
or
to live.
rotten teeth.
Yeah, we wouldn't.
Plus, you said the bacteria, the disease goes into the body too.
Everything. Oh yeah,
right?
No question about it.
Your kid could have asthma, allergies, other illnesses, stomach.
Yeah, well, and what about what we've talked in the past of if you don't have teeth that are properly functioning, what are the types of foods you're going to be eating?
Right.
Are they going to be nutritional? No, I mean, they're going to be eating all the stuff that's bad for you because it's easier to eat. All the bad carbs and the fast food, all the stuff that's, there's not going to be many good hard raw vegetables in there if you have no teeth.
So now you're learning bad habits too as a young child.
No question about it.
We're not establishing the right things to do.
Exactly. So yeah, it's starting off early in life. I mean, it's very, very important. So a lot of people, I think, that may seem common sense to, but there are still people out there that don't
I know
realize.
You talked about like pop, or if you're going to do something bad, drink it down and don't be sipping on it all day long.
Right.
Right. Whether it's coffee, tea, even.
Exactly. Yeah, you want things.
Or my lemon water.
Your lemon water, exactly. And actually, one of your doctors was talking to me today about apple cider because I know that you advocate that for digestion.
Right.
They were concerned about that being too acidic for your teeth. Listen, unless you're just sipping on that all day long, which I know that's not what you advocate, you're not going to have any issues as far as that goes. I mean, this is something, and we'll actually get to, because obviously some of the habits in here have to do with some of these drinks. So we're going to get to that.
Hey, Jeff, how about maybe some cucumber water for the kids?
I love the cucumber water. That's one of my favorite things for myself, and I love it. I absolutely. I mean, it's anything that you could put in your water that is going to make you drink it that's healthy, great. I mean, stay away from the Crystal Lights. put in some cucumber, and do that. But, because I'll be honest, I have become a much better water drinker, but it was difficult. I just needed some kind of flavor.
Something to flavor it.
And it kind of transitioned me into being able to drink water by doing that. The putting the fruits in there or putting the vegetables and just getting that just a little taste in there, make it a little bit better.
Right.
So here's one that I know Dr. Joe not only is not a fan of, and I'm pretty sure that he has never had one of these, which is a tongue piercing. All right.
Oh, I love tongue piercing. I mean, look at this tongue, Jeff.
I know that you're a fan, Dr. Joe, but I want you to know this is not good for your teeth.
I mean, I've got a rhinestone-studded tongue for all of those of you who've never seen a picture of me. It's.
I feel like for Halloween that actually would be a good thing because nobody would believe it. Nobody would believe it. For the record, Dr. Joe is joking.
Yeah.
He is. And this is actually something that really, as a dentist, it makes my blood boil. Because
I've never heard a health person talk about tongue piercing. Now, tell me about.
In my
never
opinion,
addressed this.
Well, from a tooth perspective, it's criminal. Okay, and I mean that
to the teeth.
To the teeth.
Why is that?
Well, think about this. These, some of these things have these like barbells, right?
Right.
You can't control that. They're all over the place. Do you have any idea how many teenagers have come in with a broken tooth because while they're eating, this thing gets in the way, they come down on it? Talk about ice. Let's forget about ice. How about a metal ball?
How about a metal ball?
Breaking a
ball
tooth,
bearing.
losing a tooth over a
stupid
a tongue piercing. I mean, come on. And it's so that's one thing. The other thing is the continual rubbing of this metal on especially the backsides of the teeth. I mean, this is hard.
I mean, it seems like they're always playing with it.
Always.
Too.
You can't not. I mean, this is something
in there.
that's a constant distraction, if you will.
Stimulant of.
Exactly.
Yeah.
And so, when in addition to the fact that when we talk about metal in teeth, right? And how we don't like that. The gum tissue doesn't like that. Well, metal in gums is the same thing, right?
Right.
And or metal from the ear from the piercing is the same on teeth. So I don't care if it's in your tooth or in your tongue.
Now, you think you're getting heavy metal poisoning from it?
Well, you know what? Obviously, that depends, I guess, on what it's made of. But I wouldn't be surprised.
Yeah.
I mean, who knows? Mm-hmm. I mean, unless it's
because of the acid in the mouth constantly washing over this.
Unless it's some kind of high noble, metal. And again, teenagers, how much can they afford?
Right.
I have no idea. That's a great question. All I know is that we start with the teeth, we start with the gums, and then I'm going to go one step further. Your mouth just flourishes with bacteria. I mean, it's really, sadly, one of the dirtier environments, in the world.
So you work in the dirtiest environment?
Yes, I do.
When that show Dirty Jobs in America, I mean,
I want to be featured on the next one. It's a dirty job. No, wow, that was good. I've never thought of that. But it is. What you think about that though, and then you've got a new hole in there. I mean, lip piercings are the same thing. I mean, you've got an extra spot that can just get infected.
That can just collect.
Yeah, I mean, listen,
So you wouldn't let your kids do this?
I would go so far as to say that if they did that, I have two thoughts because my kids are very young. One, I would say, well, you're not going to you have that under my roof. The other one, when I say, well, listen, that's fine. I just want to let you know that we were considering college for you, and if you're going to be wearing that and planning on getting a job someday, it's going to be very difficult for you to do that. A, with your piercing, and B, without a college education. Then I'm not going to help you. Okay, so I've thought long and hard about these things.
You've given it thought.
Well, I have a cousin whose son went through a phase like this, which a lot of kids do, and I'm okay with you expressing yourself and going through this phase, but please remember, if you're going to do something that's irreversible, okay? Having some kind of tattoo up on your neck that, really, that's a problem, okay? If you have something that maybe is for you and nobody can see, well, okay, but we're talking about being in certain types of jobs that aren't going to accept that. I think for those young listeners right now, please remember that some of this stuff is a forever thing, At least a tongue piercing, they can take it out and it's going to close up. You know, I mean,
Right.
that's at least one
Yes.
one
advantage.
one light at the end of the tunnel
Yeah.
for that, you know. So, but yeah, I just think that
So really,
again,
you don't want it to collect bacteria because it's collecting bacteria, gunk, infection that goes into your body, becomes systemic. You can crack a tooth with it, you
right?
said, and the acid, it can,
Just the actual friction of the metal on the teeth and on the gums. I mean, like you said, playing with it. I
just
mean, just
excessive wear.
excessive, and it's just a problem waiting to happen.
Yes.
You know, so if you have one, obviously be very, very careful. If you have one
Maybe
and you're
just wear
concerned
it when
about
you
this,
go out with your friends.
maybe,
Right?
sure. Let's do a happy compromise here. See, that's good parenting. See, I was like the ultimatum
Yes,
guy, but
right,
I like
yeah.
it. You're compromising.
Yeah,
That's good.
don't let me see you with it.
Right. Very, very good. Okay, well, let's move on.
What number are we on?
What
We
are
got
we on?
19 of these.
I know.
We're having fun with
This
these.
is going to be good. I think this may be
I'm
two shows.
enjoying this show
may be
a
two
lot.
shows. All right. Our next one is one that honestly, you know, I'm one of the biggest advocates for protecting against, which is grinding your teeth at night. Okay. Here, I'm going to read this verbatim just so that you know how important this is. It's not coming from just me because I know that our listeners have heard me in the past how passionate I am about teeth grinding. But teeth grinding, also known as bruxism, can wear teeth down over time. It is most often caused by stress and sleeping habits. Okay, this makes it hard to control, like we've talked about. Wearing a mouthguard at night can prevent grinding while sleeping, and this is again a unbiased opinion, and I could not agree with it more. And having what I like to tell people is this: clench as hard as you can, Joe, right now, and I know you can clench it. He's gonna clench it, okay? All right, take it easy. Do you know that power,
Okay.
is about a tenth of the power that you can do at night when your brain has reached that REM sleep?
Really?
Oh, we have, proprioception allows us to kind of know when we're doing damage, right?
Okay,
I mean,
right.
if you're, that's why we have ligaments around each tooth. You're clenching as hard as you can, but it's not hurting. I mean, you're feeling the pressure. But when
Right.
you go to sleep, that proprioception, a lot of those proprioception, you're not aware of it. And once that conscious state is not in effect, the amount of power that can happen is it's unimaginable for people. And so, if you realize how much power is happening during the day, imagine what you're doing at night. And this is where the damage happens.
So you're saying if you clench during the day, it's at night when you're sleeping, it's 10 times harder.
Correct.
Because you're not really aware of.
Yeah, and in addition to the fact that a lot of this isn't just clenching, it's grinding. So you're sliding off teeth in ways
I don't even want to think of that.
Well, and I'll tell you, and that most people who grind, who either don't think they grind or have never been told they grind, are also very poor sleepers. And the reason, mainly, is because they're skating off a tooth. It's almost like nails on a chalkboard.
Right.
And they wake up. Well, they're up. They think they're just a light sleeper and like, oh, I got to go to the bathroom. And they have it in their brain that they just had to go to the bathroom. And as we get older, as we know, we do need to go to the bathroom more.
Right.
But I'm telling you right now that the majority of these people who just think they're light sleepers or who go to sleep for 8 hours and don't get down to that quote-unquote good sleep, they don't feel refreshed, they're clenching and grinding, and they're never allowed to get down to that refreshing REM sleep that you need to be healthy and to live. And I'm going to tell you, I'm that guy. I am a person who has been a grinder since his teenage years, never knew about it. My dentist never educated me on that. Unfortunately, a lot of dentists don't, in my opinion.
Mine never did either.
Yeah. And so I got into dental school, started realizing, wait, maybe I do grind. Had one of my instructors look at me and said, oh, yeah, you need to wear a bite guard. And, of course, what did I do like most people? I didn't wear it at first. I didn't want to get used to it. Finally, I had a tooth that cracked, okay? Possibly due to my grinding, possibly due to weakened state, and
or a tongue piercing or something.
Or a tongue piercing back in my youth, and I finally started wearing it religiously. And Joe, my life has been changed, and I can't say that. I feel like
Really,
that sounds like an
Jeff?
exaggeration,
Really?
but
So
not only can I sleep better, okay, and I mean I sleep amazing now. But I literally used to juggle cold things in my in my mouth because my teeth were so sensitive to cold. Healthy teeth should not be sensitive to cold. Something's going on. There's some kind of irritant happening there. And again, I would probably say 80 to 90% of the time, it's a clenching and grinding problem. And for those of you who are thinking, oh, I can never wear something like that at night, that's just never going to be comfortable, I can tell you with confidence that I'm the least compliant patient you're ever going to meet. And if I can wear one, and not only wear one, but wear it religiously, I do not go to sleep without it, anybody can. We make these things so custom and so comfortable that you will not want to sleep without it. It's an amazing appliance. It's one of the best services I think we do at our practice, to be honest.
Sure, and you're adding to sleeping better.
Correct. I mean, it makes everybody people.
So this is beyond sleep apnea. This is lack of sound sleep due to clenching.
Correct.
Probably because their bite is off in the first
place.
And
that can happen too. Well, and also, we can't open up that can of worms, but we've talked about the fact that clenching goes hand in hand with a lot of airway problems and sleep apnea.
Yes.
It's a defense mechanism. So. Sure. Is it go hand? Sure. I mean, but the grinding itself is what we're talking about being, detrimental to teeth, which is our topic today. And what sounds like going to be our topic possibly next show.
Yes.
Because this was
was a lot of fun. I really enjoyed it.
I knew you would like
this. This was part 1 of the 19 things
that wreck your teeth.
To train wreck your teeth.
Exactly.
For those of you who want to train wreck it. But anyways, hopefully next week we will be back on to cover the second half of this.
Absolutely. I'm looking forward to it.
Well, thank you so much, Jeff. And remember, you can listen to all these shows on simpletruthsforhealthyliving.com, and you can get a hold of Dr. Jeff at 248-656-2020, Rochester Advanced Dentistry. And remember, in all that you do, eat, or drink, do all things to the glory of God.
You've been listening to Simple Truths for Healthy Living with Dr. Joseph Kanu. If you'd like to talk with Dr. Joe, call 248-656-1011. That's 248-656-1011. And tune in again Monday through Friday from 10:30 to 11 for another edition of Simple Truths for Healthy Living with Dr. Joseph Kanu.
The content on this program is for sharing general information purposes only. It is subject to change with ongoing research. It is not meant to diagnose, treat, prevent, or cure anything. Dr. Kanu encourages you to make your own healthcare decisions based upon your own research and in partnership with a qualified healthcare professional of your choice.